my colleague, Dr. Sandeep Patwardhan, who is also pediatric orthopedic surgeon at Sancheti Hospital, Pune. Both of us, we will host this session. The first question, what is the aim of this series? Why we started this series? We all are trained to master personal skill, how to make a diagnosis, how to select the best treatment, how to carry out excellent surgery. But we are rarely taught about interpersonal skills. And yet, the way we deal with people shapes our attitude towards work, towards our colleague, and even towards ourselves. This is what truly decides success, not only in practice, also in life. So what we are trying to do over here is to fill those gaps. What is not taught in medical school, we want to cover over here. So to cover what we missed in our medical education, the goal is simple: to make us more effective in our work, more satisfied in our journey, and more fulfilled as a human beings. Now I request Dr. Sandeep Patwardhan to speak why we selected the today's topic, that's a team building, as a topic, and also introduce our esteemed speaker, Dr. Parag Sancheti. Before I hand over, if you have any question, please WhatsApp me on my WhatsApp number. That's 97129 25600. Let me repeat: 97129 25600. So with that, I hand over to Dr. Sandeep Patwardhan. Over to you, Sandeep. Thank you.
Thank you very much. Good evening, viewers, and welcome to this fourth edition of What is Not Taught in Medical Schools. What is happening in today's world is that there is a lot of specialization and super specialization happening. And it is now very difficult for one individual to have all the skills and all the knowledge in a particular subject. Neither does a single person have the finances or the wherewithal to set up a center which is big enough to fulfill his ambitions and dreams or cater to his community or practice. So, this topic today we have selected is whether one can do solo practice in 2025 or whether it is important to have a group practice. And who better today to tell us about this than Dr. Parag Sancheti, who is the chairman of the Sancheti Institute of Orthopedics and Rehabilitation in Pune, which was founded by his father, Padma Shri, Padma Bhushan, Padma Vibhushan, Dr. K.H. Sancheti, who founded the hospital as early as in 1965. And as we are marching towards our 60th year this year, in December, it will be 60 glorious years of actually a team practice or a group practice. And Parag has very successfully inherited and expanded this vision of Dr. K.H. Sancheti. And he continues to lead a team of highly qualified specialties, including me. So he will be the ideal person for us to listen to as to what is the relevance of group practice, how to build a team so that a group practice is successful, whether solo practice is possible at all in today's world. And Parag by himself needs no introduction. He is an accomplished arthroplasty surgeon, very well known all over the world. He was the past president of many esteemed societies of joint replacement as well as arthroscopy. And he is the dean of the Medical Institute for Postgraduate Studies of MS Orthopedics with the MUHS and a Senate member too. So we will all now listen to Parag sir's presentation on his thoughts on solo versus group practice. And then we will have a little question and answer interactive session to bring out more and more for the benefit of our viewers. So with that brief introduction, over to you, Parag, for your presentation.
Good evening, everybody. And on the outset, let me thank Dr. Sandeep for such a kind introduction. I'm obliged, Dr. Sandeep, and I'm looking forward to this evening. This particular series, which has been started by Dr. Dhiren sir, what is not taught in medical college, has really picked up. And I think today's talk, which I'm going to give, is something which I have learned because of sheer experience, because of sheer travels. I do a lot of camps, not only in tier 2 cities, but also tier 3 cities and rural areas, and see how the practice is done there. I have a first-hand information and knowledge about that as well. And more than that, with my practice and having trained 600 alumni students in our institute, Dr. Sandeep and me also have a fair grip on how students think, how once you pass your MS, what you think, and what you would like to do in your practice. So, keeping this in mind, I want to thank Dr. Dhiren for inviting me to give this talk. And in the last few days, I've been thinking on what I should speak. So, uh, I have made a few slides and I would like to present those slides in about 30 minutes or so, Dr. Dhiren sir, and then 25 to 30 minutes, and then we'll take question answers. We've been allotted about an hour for this program, and I want to thank Ortho TV for having put this together. So I'm just going to share my screen and we'll start with my talk. Are you able to see it?
Yes, but not full screen. Yes, now it's full screen.
Okay, great. So I think team practice is which is the requirement of the day. Why, how, and solo practice is still being done versus team practice. What is it that we adopt today is the important question. I think with the time, once we started our practice and what we do today has become a big evolution. But before that, let me start by saying about the healthcare scenario in India. If you see, the majority of the population, given an option, would like to go to a private hospital or a private clinic or a private center. The minority population probably goes to a government hospitals. Nothing against the government hospitals or nothing against that, but that is what the way it is evolving, and the healthcare scenario is also now being influenced a large way by the insurance policies of various companies. So keeping that in mind, if you see the requirements which are there today, that there is a change in the expectations of the patient. The patients are expecting a lot more from the healthcare facilities. It is definitely an increasing cost which is being there to the patient. With today's advent of newer technology, newer equipment coming in, newer procedures being introduced, I think the time has to come to adapt to the change. And how do we adapt to this change is very important so that we can deliver optimal care to our patients. So this is where the healthcare is. So now is the era of super specialty. People want to develop as a super specialty surgeon, a super specialty physician. And there are essentially two types of practices which are seen today in the group kind of practice. One is a multi-specialty hospital by itself, where there are multiple specialties being practiced in that particular hospital. And we see these multi-specialty hospitals in mainly, tier one cities, which are typically 50 bedded, 100 bedded, or even more. The single specialties hospitals with their subspecialty is growing, where we have orthopedics, which may be a single specialty with subspecialties. There may be general surgery, there may be ophthalmology, there may be gynec, which also has various subspecialties which are available within them. So we have to understand today that the days are changing and these group practices are coming into vogue. If you take example orthopedics, and similarly, I'm just putting an example of orthopedics because most of the people on Ortho TV might be the orthopedic surgeons hearing to it. But of course, this can extrapolate to any single specialty today, may it be general surgery, oncology, ophthalmology, and there can be subspecialties in each of these super specialty. Especially in ortho nowadays, we have trauma, we have spine, we have arthroplasty, arthroscopy, pediatric orthopedics, foot and ankle, and also there is a hand, which is becoming a specialty. If you see in 1970s or earlier, the general surgeons were doing most of the work and they were doing even the orthopedic work. 1980 onwards, orthopedic started to be recognized as a specialty and the general surgeons were distinguished for doing some other work and orthopedic grew as a super specialty. Then came the era after 2000 where people started recognizing trauma, pediatric orthopedics, arthroscopy, arthroplasty as a subspecialty of orthopedics, which is now even growing more and more. Essentially, there are two types of practices. One is the solo practice, where typically it's a one-man show, and a group practice. So, for a minute, if we see the evolution, people used to, when they did general surgery or orthopedic surgery, even there was one person who could do the spine work, the trauma work, the pediatric work, and he was like the master of all, but the jack of none. With the advent of the super specialty growth, now what we want is to master one and know most about the other specialties. So, keeping this in mind, I think there are certain advantages of solo practice. Now, this can be done keeping in mind what your particular specialty is. It depends upon the nature of the doctor, what he wants to practice, where he is practicing. If it's a small rural area, you know sometimes it might be better to do a solo practice, but at the same time, it has its own advantages and disadvantages. What are the advantages of solo practice? You're in full control, you make all the decisions, you don't depend on anyone, you don't ask anyone. You're the whole and soul, the main master of the hospital, and it is your particular way how you want to lead it. Nobody's going to question you. The profits are all yours. If there are losses, it's again your responsibility, and you don't have to share those things with anybody. All these advantages also come with disadvantages, and I think the solo practice now is becoming more limited, and it is not becoming more practiced all over and even in the smaller places, because of the whole burden of that hospital coming on one individual. Again, there is no backup. The person who may has to be on call every day, he does not get any support, and it is very difficult for one person to do everything, and he cannot really scale up. So there are so many disadvantages of the solo practice. Versus if you do a group practice, the all the advantages are for you. And we will talk a little later about what these group practices are and how we can, talk about various types of group practices. So, firstly, the most important advantage I would say is that your responsibilities get shared. And then, in that, of course, along with the responsibilities, the resources, the cost, everything gets shared. Whenever you have a group, you can have time to update your skills. You can attend CMEs, conferences, and keep on updating your knowledge, because even now the IMA and the Medical Council has made it compulsory to have so many points for your credit. Otherwise, your license will not be renewed. So I think that is what will give you the time if you're in group practice. If you're alone, you will not be able to update that. Also, there is the ability to discuss some complicated cases with your colleagues. If you want to scale up the model, expand, it is possible. Then, of course, you have a coverage of other duties, which are the casualty duties, which can be shared. And for example, if there is a legal suit, if there is some consumer case against you, then you're not the only one in it. You have colleagues, you have your group partners who are going to help you with that. So that is why nowadays people are thinking about collaboration and group practices. What comes with it is, of course, the improved outcomes for patients. If it's a surgical group practice, it can be surgical, it can be medical, depending on what particular specialty it is. Definitely, you will have more time for satisfying your patient. The patient experience can improve. There is reduced staff burnout. I think burnout is a new concept where people talk about, getting tired, getting fatigued mentally, physically, and that can lead to burnout, which is now becoming a popular term amongst residents and junior consultants. Of course, when you have a team, you can do more academic reading, you can get into research, and there are more opportunities for this kind of growth and updating your knowledge. However, whenever you're doing a group practice, there are certain disadvantages as well, which you should be aware of. Because of the finances involved within the group of more than three, four, five people, there can be conflicts. There can be differences in vision. Initially, once you start there, everything people agree with everybody. But then as the time goes on, there can be conflicts, which can be because of one partner, if he's doing good practice and the other partners are not doing, then he feels that he's running the hospital and the revenue is shared. There may be, decisions which are conflicting because of the egos. There may be some imbalance between the specialities in terms of the work or the share of the work or the night duties they have to do depending on what their specialty is. And all this can lead to major disagreements. So I think this is something which one has to keep in mind depending on what type of group practice you're doing. So whenever you want to start group practice, I would like to say that there has to be a very, very clear understanding on what those four doctors, five doctors want to achieve. You have to define the responsibilities which are there, because unless you describe those responsibilities, there are going to be chances of conflict which can happen once your practice starts. In the initially, it's like a wedding, everything looks good. A few months, few years down the line, there start cropping differences, there start cropping misunderstandings, and then we say, oh, I didn't know this before, I thought this was this way. And the moment that word I thought comes, that means you haven't discussed it. You would have thought and you assume things. So I think today it is very important to have that clear understanding amongst each other while starting some kind of a group practice. And for that, I would say that there has to be a complete, frank, and open discussion between the partners who are going to do the group practice. There may be an MOU which you can sign, you can register, so that if something does go wrong, you can say, okay, refer to the agreement. What had we discussed? What had we not discussed? And try to put in as many points as possible which you think which can be of conflict later. And of course, you have to completely understand the financial involvement. Majority of the issues what I have seen in a group practice arise because of the financial issues. So on day one, if you are clear, what is the distribution of the share? What is the distribution of the profits going to be? What is the investment each person has made? Sometimes some partners may get on the table the investment in the form of land, or some may say that they may have some capital investment. So I think all that, if it is not discussed before you start the hospitals, it is like a recipe for disaster, a recipe for misunderstanding, and a recipe for breaking the group practice. So I think it is very important that each one who gets into this group practice has a clear understanding of his roles, his responsibility, and that can be accomplished by effective communication before starting the hospital. There has to be a shared vision. All the partners should have a similar kind of mission vision, which they all agree to and they all work towards that vision. If their vision is different in different partners' mind, then again they are not going to get together well and they're going to have a clash at some point of time. The partners have to respect each other and more importantly trust. That if the trust is lost, then everything is lost. If you start doubting each other and don't have the mutual accountability for each other, then again the conflicts will start, and again this is a recipe for disaster. So a clear responsibility has to be defined, and who's going to play what role has to be defined, and that has to be put on paper, signed, documented, and referred to as and when if there is a conflict. Coming to the responsibilities, what are the responsibilities in a good practice? And in today's age and time, when you start a hospital, it's not as easy as before. There are many compliance issues which have to be handled. There are administrative issues, of course, financial issues. There are legal issues which can come up. Not I am talking about the consumer things, but you have to take certain legal permissions. You have to take legal clearances. The charity commissioner has to be in play. The corporation has to be brought in. All those permissions have to be in place. The infrastructural licenses are required. And of course, you have to make the capital investment to get the proper equipment so as to have the infrastructure ready for the hospital. So when you make that MOU, all these responsibilities have to be divided. If the hospital is slightly bigger, you're having a little bigger group practice, then these other administrative responsibilities come in. Today, my talk is not going to be about this, but at some point of time, Dr. Dhiren, I can also speak about the various administrative responsibilities which are there in the hospital, which probably are best run by non-doctors. So if you are going to start a group practice, initially you have to be responsible for hiring resources, maintaining quality, getting the security, getting the proper nurses. The insurance should be on board. You have to maintain the quality of the hospital. Another important issue which comes is the pharmacy. And that is again a big dispute which can happen because pharmacy in a hospital is a good area for revenue generation, and therefore sometimes some partners take more onus of the pharmacy, and then there can be issues. So I think the pharmacy also has to be well discussed, well kind of looked after once you're starting a hospital. And all these administrative responsibilities have to be shared. And it is best, I would say, that if the professional doctors who are coming together can hire administrative staff who are not doctors for these responsibilities, then the chances of conflict will reduce. And for this, again, it is important that you build a proper team. Important is the quality team has to come into place, and it depends on what kind of practice you are doing, whether it is a single specialty with multiple subspecialties or a multi-specialty hospital. Now this brings me to the second part of my talk. After having talked about the solo practice and the group practice, whenever you want to do a group practice, then there are various kind of models which are available today for starting a group practice. These models are mentioned here. One is like a shareholding. You get a piece of land, you invest as partners in that, and then decide the shareholding pattern, and then the profits can be divided. In this, each person who does that particular surgery or a procedure or sees a patient can get a fee for service. The other income is put into a common pool, and depending on the shareholding, the profits are divided. The second model I will talk about is the nursing home model. Then we come about the institute model, like the Sancheti hospital, which I'll talk about a little more. People also like to join the government medical colleges or hospitals, which can be one opportunity. The next is the Mayo or the Harvard model, where the most of the American multi-specialty hospitals, the way they practice. I will discuss briefly about that. And then the corporate hospitals, which are now coming up in the uh, tier three cities. So talking a little more about the shareholding model. So in this, what is important is to have the proper shareholding, proper division of the income. And I think whatever work that particular individual doctor does, he gets that particular share of the professional charges. When I say professional charges, you should understand that when a patient pays a bill, it's not 100% professional charges. 25 to 30% of the bill is usually the professional charges. Remaining can be the X-ray, the OT charges, the room rent, the pharmacy, the other expenses. So that can go to the common kitty, and then that end of the day can be divided. There are certain advantages of share holding model. The important advantage is that the risks and awards can be shared, the talent can be brought, and then once you have everything in place, the accountability, of course, increases. Coming to the second model, which is again quite popular and being practiced not only in the bigger cities but also in the smaller cities as well. Here, what happens is that the nursing home and the land is owned by one person, usually a doctor, and then he hires the doctors, or the doctors take his nursing home for doing their operations or admitting their patients. And for that particular facility, the nursing home owner gets paid and the doctor gets paid. So this is a good model where the responsibility of the doctors is also not much. The person who owns that nursing home has to handle all the administrative roles and the legalities, and the doctors come when they have their patients admitted or admit their own patients. And this model can work very well. The person who is running the nursing home may be a doctor, may not be a doctor, but this can be a good model for a group practice, especially if you don't want to take much responsibility, but you are attached to a particular hospital. Talking about institutes, I think I can give you two examples. One is the Sancheti Institute and the Ganga Hospital, which work on this model. So here there may be a single promoter or owner, like Sancheti Hospital, Dr. Sandeep did mention, was started in 1965 by my father. And at that time, he used to do most of the things himself. He started it as a 10-bedded hospital, about a kilometer from where the current hospital is. Slowly, then he grew to 50 beds, 100 beds, 150, and now we are at 300. So I think what has remained common all across is that we have made teams initially from a single specialty, one person doing everything. Now we have subspecialties. Dr. Sandeep is in charge of doing the pediatric orthopedic work. Similarly, I'm more into the knee work. We have a hip surgeon, we have a trauma team, we have a spine team, we have a hand and upper limb team, we have a shoulder team, foot and ankle team. And these people do that particular work. So whatever work is referred to the hospital is referred to that particular specialty, that particular trauma surgeon if he's on call, that particular knee surgeon. So there is never ever any conflict. If a spine patient comes, the trauma surgeon will not say that I'm going to do this case. Or if there is an adult patient who comes with arthritis, Dr. Sandeep is not going to say that I want to do this case. Similarly, if it's a pediatric patient up to the age of 16, then Dr. Sandeep and his team will look into it. So there is a very clear-cut demarcation and division of work, and that has really worked very well. And there is definitely an opportunity in institute for the teaching purposes. Like the Sancheti Hospital also has a very big residency program, a teaching program, and it is associated with the Medical Council of India, that is the NMC now, and the Maharashtra University of Health Sciences. So the surgeons get an opportunity to also climb the ladder from that perspective, and there is academic growth. Since they are in a institute, they are in a hospital, they can concentrate on their research work, concentrate on their academic work, attend conferences, and spread their work. And they have residents, they have researchers, they have a whole team. And in the Sancheti Hospital, the people who do the administrative work are completely different from the professional team. So slowly, in these 60 years, we have managed to reach a place where we are able to work together cohesively. There are two important things in an institute model or this kind of a Sancheti Institute or Ganga Hospital model. We have to retain the talent. And I think that is something which I feel is the most important thing, me being the promoter and the chairman of the hospital. And it's not only about money. I think it's about the job satisfaction. It's about the work culture. It's about the work ethics. It is about, the whole team. What is the ethos of the team that will keep these people together? And I'm very happy to say that, the people, our consultants, our pillars have been with us now 20 years plus, most of them, and we are able to work very cohesively. So that's the institute model. Talking a little bit about the Mayo Clinic model or the HSS or the Harvard model, where what happens is that there is a group of doctors which do a clinic in that particular hospital, admit their patients in that particular hospital, and they work there more like a fixed salary. And there is usually, again, no competition. There is collective responsibility for each patient's outcome. And again, the important thing is in the US, where most of the hospitals are controlled by the insurance system, the working model differs little differently. Like the practice place, the clinic place is the same. There are 3 or 4 doctors who form that particular group, and then they do the so-called group practice also in their clinics. The advantage is again the chances of conflict are less, but again, sometimes because of the hospital policies, the governance, there can be some challenges here. The last type of the model which I would like to speak is now the corporate model, where the hospital is not owned by any doctors. It is owned by investors and it is owned by a corporate entity where that company may be a private limited company or it may be a public limited company. So I think that is something which is now coming up in a big way. Many of the tier 3, tier 4 cities have these corporate hospitals, and again, there are certain advantages and disadvantages of a corporate hospital. The chances of that hospital being bought over are there, and sometimes there is no assurance or guarantee for the doctors working there that who are the investors, who are the owners, and that can be a problem. So, what is the need of the hour today, friends? I think the single owner solo practices are moving out, and today the time has come where most of the practices will be a team practice, a group practice, and that is what I feel is the way to go ahead. What is the requirement of the day is not a solo performance. I think it has to be a symphony where various performers come together and then you play the orchestra and then what comes out is melody. I think that is important. Medicine is going to be like that. It's not going to be a solo performance, it has to be a team performance. Therefore, in today's time and date and era, we need a team. Together everybody achieves more. So that together is important, that TEAM is important. And today the days are gone when one doctor can make a difference. When Dr. KHS started his practice, one man built it, but then of course very soon he realized that it's not going to be a one man show and it has to be a team, and that is why we have achieved what we could achieve. As I come to the end of my talk, I think it will be important for me to say that each individual is different. And this is a very important slide. Each personality is different. So I think you have to analyze yourself, whatever you're suited for. If you feel you're suited for an entrepreneur and you want to start a group practice and start a hospital and take the risk, so be it. If you feel no, I just want to have a 9 to 5 kind of a job, you may join a medical college and you may do that. If you feel no, I really want to get into and grow my practice and I want to have the proper infrastructure and everything in place, you may join a corporate hospital. I think it is end of the day what best you're suited for. And you have to discuss this with your family, with your friends, with your peers, and then come to a decision on the various models which I just discussed with you. May it be the group practice, may it be the revenue sharing shareholding model, may it be a nursing home concept, may it be the Mayo Clinic concept or medical school. I think each one has to analyze for himself what works best. And of course, when you are doing things together, as I mentioned in the initial part of my talk, the responsibilities get shared. You have more free time. You can have a proper work life balance. You can manage your academics. You can manage your family. There are issues you can discuss with your partners. If there are litigations, consumer cases, then those can be tackled with 3 or 4 people together rather than one person getting stressed. So if you want to walk fast, walk alone. But if you want to walk far, if you want to have a good patient experience for all whom you are treating, then the teamwork is what will take you long. A strong team has to be the backbone of any healthcare facility. And nowadays, we have various specialities of hospitals applying various teams which come together. Leadership, communication, and respect drives the success, and team building is a continuous process. So, friends, I would like to end here by saying that solo practice can be done, but I think the days have gone. You have to now think of doing a group practice or a team practice where multiple people can come together in the various models which I have mentioned to you. Take collective responsibility, have a shared vision, and move on. Because I think if you take out the team in the teamwork, it is just work. And now, who wants that? We definitely want to have a better patient care. We want to have a better patient experience. And for that, you need a team so that you can influence your patient management well and give them a good outcome. Ultimately, the interest of the patient is the only interest what should drive your group practice. With that, I would like to thank Dr. Dhiren sir and Dr. Sandeep for this opportunity and for having invited me to give this talk. Thank you very much.
Thank you, Parag. That was really a very, very excellent overview of the strong reasons of why it is necessary to have a group practice and the various models of how to go about building a group practice. Thank you very much for those insights. I think we will open up this session for question and answers. And I would first go by asking you, as a team leader or a promoter who is having a successful team practice, amongst all these team members who are highly skilled, specialized, and competent, what is your mantra of binding the team together? How do you avoid conflicts, ego problems, and still keep the string of pearls together instead of scattering the pearls and everybody goes his own way? So, is it the money? Is it the work? Is it the academic part? Or is it how do you uh, do man management? I think that skill is the best, most important skill. And what is the solution for people who want to do something like this? What is the skill that they need to possess?
Absolutely. It's a very, very pertinent question, Dr. Sandeep, what you asked. And if you ask me what is my single most challenge today, it's not about running the CSSD or running the security or the FNB or the accounts. I think it is talent retention. That is something which is important. And for me, I always like to hear the consultants, the top management people, our hospital in charges, and especially the consultants, because I think it's not about money. Money is important. I'm not sidelining it. But once the certain level has been accomplished, which is required to have a comfortable life, then what is it that the consultant is looking for? Number one, academic excellence and to have a good, conducive teaching atmosphere. Number two, to grow himself in that Lord ladder and be known in the orthopedic fraternity. Number three, to have that job satisfaction, end of the day, that patients who he gets healed, whom he gets cured, who thank him. And the last is to have a work-life balance. I think if these four things which I always strive to give, apart from the financial things, then that is the success for the mantra of the institute. And that is what I always think. There are going to be in a family, there are going to be some kind of quarrels. There are going to be certain expectations which are not met with. But what, Sandeep, I can tell you very frankly is that one has to be patient and one has to hear things out and they take decisions in a very balanced way. At times, certain decisions have to be taken when you are compromising on the principles or the basic ethics. Then there is no looking back. Then you have to take those hard decisions. But if it is not really compromising your basic principles, or it is not a non-negotiator, then I'm willing to change. And that is what I have learned from KHS sir, who's always willing to go that extra mile to do that change. Even if yesterday he has said something and somebody can convince him, he's willing to change 180 degrees. So I think this is
Yeah.
the flexibility, what I feel is the mantra, and what we have been successfully able to have nearly 18 to 20 full-time orthopedic surgeons with us more than 20 years.
Right. So, do you think that a flexible approach towards each person allows you the freedom of holding the string together? Or is it that you have to have rigid approach and make a common rule for everybody? Does that work better in man management, or it is horses for courses?
I think
Things may be malleable as per a person's temperament and personality, as you said, to keep things together. That is one part. And the second is, does the approach change depending on the seniority of a particular consultant? Because people want different things in life at different age groups. So, how do you tackle that? Because this is a very important skill, I think, which
yeah.
people should understand.
So for any group practice to thrive, or also a practice like for us to thrive, there has to be some flexibility for sure. And suppose our trauma surgeon wants to do a certain surgery in his way and he's able to deliver the results, then we cannot tell him that no, no, you have to nail this fracture or you have to only plate this fracture. No, you have
So,
to.
you are giving autonomy in decision making for
Absolutely. That
profession.
was the word I was coming to and
Yeah.
I was looking for. So autonomy to that extent to for his decisions making has to be given. One cannot question it. What you can question at the end of a year or once you do an audit, okay, doctor, now this is what the results are, and this is what the problem is, the complication rate is high, then we can tell him. But otherwise, I think that flexibility, that freedom of thought, that autonomy has to be given for any group practice, and that respect for each other has to be maintained.
The second part was about the age groups.
The age groups with seniority, of course, the more maturity is there and particular
So the
respect.
youngsters have different things that they want out of the practice. Middle age want something else. Seniors want something else. So how does one balance out or tackle these variables?
So I would feel that once you are just starting your practice, you have to definitely put in more hours. You have to work hard. You have to get together your practice. You have to make that name in the community so that patients
Correct.
will come to you. Once you've done that, then, with more experience, then the other things can be considered upon. And you have to always make sure that the patient's interest is always kept in mind. And what you do for the patient has to be done with maintaining the
Right.
maximum and the highest level of ethics.
Right. Like you always say that there are some negotiables and some non-negotiables.
Yes,
The non-negotiables cannot be compromised upon. The rest,
never.
everything can be discussed.
Absolutely right. Absolutely
Yeah.
right.
Dhiren bhai, I think he wants to ask
Yeah,
questions.
yeah. So I have a couple of questions. The first question, to convince our audience about the teamwork, you explained very nicely, gave a very good theoretical background and the reasoning. Now, from your vast experience, can you share one example where teamwork has directly improved patient care?
Definitely. So, for example, if you see the casualty of Sancheti Hospital, we nowadays cater to a lot of polytrauma. We are having patients who come with head injuries, abdominal injuries. So, we now have a group of doctors who are along with the trauma team having the ability to treat head injuries, abdominal injuries. And even when there is a polytrauma, there may patient has certain injuries like an acetabulum or a foot and ankle problem. So we have now certain doctors who are treating doing only the acetabulum fracture. So irrespective of what day he comes, there is that particular acetabulum fracture will be treated by that particular doctor. If it is a foot and ankle, a calcaneal fracture, then that particular doctor will do it. So there is definitely the best person in the hospital is allocated that job, and therefore the outcomes will improve, and that is all available under one roof. If there is a vascular injury, now we have a full-time hand and vascular surgeon. We have a plastic surgeon who is a full-time doctor with us. So therefore, we are very efficiently able to deliver these services, and we do not rely on anybody who is coming only for a part-time. We are self-sufficient, and these group of individuals who work together along with a good ICU team, along with a good anesthetist, that is also important. A good uh, pain management person will be able to really deliver the best care to the patient. And I think that is what the mantra is. Even now, the Sancheti Institute is 60 years. Forget that for a moment, that. Uh, but if people also start in a small way, five or six doctors come together, and let us take an example of orthopedics. One can do arthroplasty, one can do arthroscopy, one can do pediatrics, one can do trauma and spine. And these are the main revenue generators in any orthopedic practice. So if one particular person is doing that, then he gets better and better at that particular subspecialty, and he's able to deliver the best. So I think to answer your question, at Sancheti Hospital, if a polytrauma patient comes, he's the best managed for his vascular injury, for his skin loss, for the head injury, and for the various fractures by a team of doctors, which will definitely have a better outcome for him.
Okay. The second point which I realize is like, no doubt you are at Sancheti Hospital, which is a 60 years old institute. So you have reached to a level where, like, where you already have a like 20 or more than that consultant with you. Now let's go back to a slightly different level, and someone who has just started a practice. He's really doing well, and now he's trying to think to take a one orthopedic surgeon or the same specialty doctor as a partner. So the what will be your way of like dealing with this situation? I know that you have very little experience in this direction because you have already started with already 10 or 15 people with you when
No, no. So I can definitely answer that because that is what I advise my students now. Because
exactly, yeah.
they are always going and starting practice in a little smaller area, in an area where there are not many super specialty, multi-specialty hospitals. So for them, my advice is always is to get together with like-minded people. Now, how do you know that they are like-minded people? I think the only way to know that is by discussions, meetings, and understanding each other's thought process. And therefore, in my second last slide, I did say that what is your mentality? What is your makeup? Are you a teams person or are you an individual person? If your personality is individual and I want to do what I want to do, then you're not suited for a team practice. So I always tell my students that you should identify 3 or 4 people who are like-minded and who can come together to start a practice. Because of that, group practice, lot of responsibilities get shared. And a one-man show running, a jack of all trades and master of none, I think that those days are gone because then the patient outcome is getting affected. So my advice is to have proper discussions, proper meetings, think of all the possible conflicts which can happen before time, and get people who will complement each other, not compete with each other. Now, for example, to get an anesthetist, of course, you have to get an anesthetist. To get a physiotherapist, you have to get. There is no problem. Those are not going to compete with you. But when you are selecting your partners, make sure that your interests are protected and you are not stepping on each other's shoes in the long run so that then your practice can sustain. There are two main areas of conflicts which usually come up. One is the financial thing. That is something which you have to decide and kind of dissolve ahead of time. What is the revenue sharing pattern? How much are the shares? And what happens if there are adversities? What happens if there are going to be difference of opinion? So always have some senior friend or an arbitrator kind of a person in place so that in case you have a difference of opinion, you mention it ahead of time that, okay, I will go to this person. And I'm, to be honest, helping 3 or 4 group practices, and if they do have some conflicts, that person, that arbitrator or that senior person can be of help and then they are aligned and then they get on with their work. So this is what I would advise, people who want to start smaller hospitals, 20 bedded, 25 bedded, or to in that range.
Okay, Sandeep, now you can ask. You are mute.
Sorry. So, Parag, what do you think about this corporate practice structure, where a big non-medical group of people look at hospital like a business, and their bottom line is profitability, scalability, market share, market value, and resale. In this whole chakra or dushta chakra, do the patients suffer? Do the young doctors suffer? Do the senior consultants suffer? Because if they put their skill and time in such a basket, what is going to happen after 5 or 10 years? Do you think that the corporate culture is going to really benefit either the doctors or the patients in the long run? Or it is an American borrowed concept which is not going to sustain in the long run?
See, like it or not, these corporate hospitals are going to come and they are going to be there in a big way. I think what is important is the patient care. And if the patient care comes above whatever the aims and objectives of that particular
No,
individual
so
group
if the
be, then it's
corporate
a
is not
problem.
owned by a doctor, patient care is not of prime importance. It is the market value. It is NAV.
Yeah, that's true. That's true. But at the same time, what these individuals do at a corporate level is outsource everything. They get managers to run the hospital. They get administrators, and if that particular administrator is able to keep all the consultants together and instill in them the that the patient care is important. If that is going to be driven, and that is very well seen, you can make out how corporate hospitals are running and what they are doing. Because they're a public limited company, they also have, certain targets to achieve. They have to make sure the dividends are paid to the shareholders. And then that becomes a different game because the hospital is run by somebody and somebody else at a higher level is monitoring all the revenues, the top line, the bottom lines, and targets are being set. So I'm a firm
So,
believer that no matter what, there should be no target set. There should not be that, okay, X number of procedures have to be done in a day. Y number of patients have to be seen. At best,
so
we can make sure that you do a proper propaganda, you do a proper business plan, a proper promotion of that particular doctor, and then the patients will come rather than setting targets. And then there is a thin line which divides, it indicated and unindicated case. And sometimes, you are the only one who knows in your heart that you're crossing that thin line. So that is the difference. And I always feel that if you feel inside that the certain procedure is not to be done, it's not to be done. Then you should not be influenced by anybody above you. I think that is the most important thing, what one should keep in mind.
so let me get a little cheeky here, Parag, and ask you a very difficult question or
Sure.
sort of a question. Suppose tomorrow a big corporate firm comes and says, we want to buy Sancheti Hospital. Name your price. Would that be a good proposition for you? How would you plan succession?
So I
Because
haven't
it's been
thought.
60 years. It we don't know about how the things are going to happen because there is also a timeline to a doctor's
No, no, no. So that's
shelf
a very
life.
far-fetched
So
thing, Dr. Sandeep.
no,
What?
because all your senior kid are also seen in 5-10 years would like to slowly phase out, or it's time to give the youngsters also a chance. So how does one look at
Yeah.
succession and selling out to corporates because that's the
That is
culture? Do you
going
think
to
it's a good
never
idea?
happen, selling out or doing that because my aim is more of, I have a philanthropic approach. I really want to make sure that we are able to reach the masses. And if we sell out, which will never happen in my lifetime, I can assure you, then my particular vision or my vision of reaching the underprivileged, reaching the masses will never be achieved. So definitely we have to get
So
more
the
younger
bottom line
blood.
has to be patient care.
Patient care. And we have to now get younger blood, as you rightly said, get newer people in the practice so that then, they come up. Now, another thing which did not come up, or which I would like to discuss, is the various schemes which the government is enforcing on us. They are telling us to take the Ayushman Bharat. They are telling us to take the Shahri Garib. They are putting the charity commissioner rules into place. And all these things also have to be thought about. I think the time has come now for us to be together in this so that, the government, of course, is going to look for the vote banks and is going to look to please their voters by, telling the doctors to do what they have to do. But I think the time has now come for us to be together and at the same time when we do want to help the masses, but it should not be at the cost of compromised care. I think that is important for me also.
Okay. The another question, which is like most of us believe that when we go for a team approach, 1+1 is equivalent to more than two. But then there is another point or the aspect that's called the social laughing, LOAFING, laughing. By that, it says that when you are in a group, some people they tend to take a back seat because the other people are performing well, so they allow them to do the work and they just sit relax. So how do you take care of the social laughing in your institute?
Yeah, so I think what we have the model is that, you know, the person who performs will get the best deals. If somebody is not performing, if somebody is not able to keep up to his practice, then obviously there are ways one can make out. And then, he should be happy with what he's drawing in terms of the financial models. There are some people, not in our hospital, but sometimes in a shareholding practice where they say, okay, I've just put in my share, let me get my dividend. I don't want to exert, I don't want to exert myself or do that extra duty. But I'm happy not to earn so much. I think end of the day, it depends on the personality of a patient. Whatever you invest, you get. If you don't invest and you don't want to invest your time, energy, talent, you're not going to get back the returns in that proportion. So I think to answer your question, the social offing can happen, and we have to have a system where you get as per your merit, as per your experience, as per what you invest, and so you will reap.
Yeah, but that's true. When it comes to practice, you definitely decide according to the how much you work. But in addition to that, there are some other responsibility than the practice. Something like in a teaching institute, you have to teach, also to carry out research. So at that particular point, how do you decide the criteria for measuring the output or the
So
efficiency?
in that, of course, then in a hospital like ours, where we do have a residency program, then teaching becomes an essential part which all of us have to share. And that, in fact, becomes very helpful for them because they stay update, they read because they have to teach the residents. And I think that is more of a boon rather than, looking up that, okay, I have a clinic tomorrow, I have to teach the residents. It definitely helps you to remain updated. The second thing is you cannot really force somebody who doesn't want to do anything. And then at the end of the day, in a group practice, forget the institute like Sancheti or Ganga. I think it is important to understand the traits of a person and to understand what his aim or his particular what he wants to accomplish. If that particular interest of that person is not matching with the vision of that particular group, then I think that is again a recipe for failure of that group, and then the controversies are bound to arise. So to answer your specific question, there have to be some measurable and tangible things which can decide, how that person is doing. And at the end of 6 months, 1 year, there should be an audit to decide how he's doing in that particular group practice. And then they sit together and decide the way forward.
Okay. Then the other very important prerequisite is the trust between the team members. So, can you suggest something how to build trust?
I think that's a very important virtue which has to be there. And the most important quality, I would say, for developing the trust is to believe in each other. I think if we always feel this person is cheating me, if this person is doing something wrong, this person is doing something which is not in line with the vision, I think first trust comes with belief and trust comes with a shared vision. Once that is there, then the things fall into place. To also trust each other, there have to be certain boundaries which are defined. There have to be, certain do's and don'ts which have to be defined. There have to be certain processes and protocols in place. Because suppose something goes wrong, and then, that particular deed which a surgeon or somebody has done comes to light after 1 year, and that we don't know for that 1 year this person has been doing certain things, then that breach of trust will be known after a year. But if there are certain red flag systems, there are certain checks and processes, then absolutely there is no problem, then that trust will be there. And I think the trust comes with time. Trust comes with understanding each other. And each one has limitation. Each one has two sides to a coin. So in a group practice, it's important for us to understand the shortcomings of the other person. And whenever we make a team, it is important to complement each other rather than compete with each other. And more you discuss, more you have meetings before you get into an understanding, less will be the breach of trust. And end of the day, it is a personality. It is a inborn thing. It is a virtue of that person. And there are certain people I've seen, they keep going to different hospitals, they take attachments, they leave. And that is purely because they are not aligned with that particular team's philosophy or that team's interest. And most of the times, I have seen the breach of trust is because of financial issues. And if there is something which the deed of the partners or the group of hospitals has promised and then it is not delivered, then that distrust starts. So I think if you have to maintain the trust, it has to be very clear what is the objective of the hospitals, what are the aims of the hospital, what is the ethos, what is the vision, and then each one, if they are aligned to the bigger picture, the smaller differences of opinion don't matter and they will be resolved very easily. But if there is a breach of trust, then that can happen. But I have been very privileged. We have a great team, and that particular issue till date has not come. So that is because of the understanding amongst each other, the respect for each other, and the belief we have in each other. I think these are the three important qualities for having a group practice with trust in each other.
Yes, so now we are coming to the end of the program. And first of all, thank you very much for laying down the foundation on this important subject. I know that in 1 hour we cannot cover everything. So definitely we are going to have more sessions because we need to understand a lot of points and the issues related with the team building. So definitely we are going to have more sessions on that. But before we close, my heartfelt gratitude to our speaker, Dr. Parag Sancheti, for delivering such an engaging and insightful session. It was not only the lecture, but the interaction also gave us a lot of insight about this topic. And also to our dear audience, our sincere thanks to you all, because without you, such program cannot take place. And we also value your feedback on today's program. Please share your thoughts on the WhatsApp number 97129256000. And every time, at least 10 to 20 colleagues, they send their feedback about the lecture and like what more can be like discussed in this topic. My special thanks to Dr. Sandeep Patwardhan for asking thought-provoking questions, very tricky questions to Dr. Parag, and also sparking and rich discussion. And finally, like as Dr. Sancheti already said, but my deep gratitude to the entire team of Ortho TV. And because of Ortho TV, we are able to reach thousands of people, not only in India, but worldwide. And so making this event possible and also for bringing this for all of us in a massive scale. So with that, I end and I would just like to tell you about the upcoming program. The third session was on life work life balance, and a lot of people they really like the lecture of Dr. Anil Jain. So we are also going to have a similar lecture by Dr. Hemant Vakankar, again from Pune, and he's going to speak on a different aspect of work life balance. So not focusing on the life but also focusing on the practice. So that lecture is on the 8th of November, Saturday. I will keep all of you updated about that. So, with that, thank you everyone, and I wish you a great night ahead. Thank you.
Thank you very much.
Thank you for the
Thank you, Dr.
Thank you.
opportunity.
Sandeep. Thank you,
Yeah,
Dhiren sir.
Thank
yeah.
you,
Bye.
Parag, for the
Thank you,
wonderful
Bye.
Dr.
point.
Ashok, for this opportunity and for broadcasting this on Ortho TV. Thank you very
Thank
much.
you, sir.
Yeah,
Uh, thank you so much, sir.
yeah. Please end the. Yes, good.
Okay.
सेशन हो गया ना रिकॉर्डिंग बंद किया ना मेरे को खुद भी
Yeah,
हम लोग
yeah.
Chalo. I hope it was
अशोक
all right, sir.
No,
अशोक